Hello and happy Friday. This is Superintendent David Miyashiro, and this is really made for the employees of the Cajon Valley School District. Happy Friday, everybody. There have been quite a few news stories that have caused a great deal of concern and questions, and rather than put out a statement, we wanted to speak to you directly. And so we have some guests here that I'd like to introduce you to, and we'll start from our left.
Hi, my name is Brisa de los Santos, and I'm the Administrative Secretary for the Health Services Department.
Hi, I'm Jenine Henry. I'm the Assistant Superintendent of Student Services.
Hi, I'm Jennifer Shultz. I'm one of our district nurses.
And I'm Scott Buxbaum, Assistant Superintendent of Business Services.
So we're going to talk to you today about employee raises and also the coronavirus and our district response. So why don't we start with the coronavirus, and how is the coronavirus different from the flu?
So the coronavirus is now commonly called COVID-19, and just like the flu, it is a virus that affects your respiratory system. So they call it a respiratory illness. Different from the flu, so far the flu has affected more Americans this year than COVID-19.
Do we know how this virus spreads? Is it different than other viruses?
It spreads just like other viruses, just like the common flu. It's spread through respiratory droplets. So let's say if I cough or sneeze, it might accidentally get on David, and then if David were to touch his eyes, nose, or mouth, it could affect him.
Can you tell us what precautions the district is taking, both at the school site level and then other areas around the district?
Sure. Well, first of all, we are monitoring very closely, hour by hour, everything that comes out through the County Office of Education, through the Center for Disease Control and the Health Department. Any advisories, anything that is coming out, we're aware of. And really, we've also been trying to keep families informed about the best way to stay safe is good hygiene. So washing your hands and making sure you use a tissue when you blow your nose so that we're not spreading those droplets. And Brisa has actually been behind the scenes with information letters to parents. And tell us a little bit, Brisa, about what you've been sending out.
So all sites have been sent posters with tips on hand washing, and we recommend that hand washing, you wash your hands for at least 20 seconds.
And then we also have been working on a protocol, in case we do have any cases of students that demonstrate any of the symptoms. We implemented a protocol with the health office staff and with the office managers. So if a student comes to the office and they're demonstrating symptoms which are a fever of over 100 and coughing or anything like that, the first thing that we ask staff to do is to ask the child if they've been to mainland China. Now it's spread to Korea, Italy, and Iran, if the child has been there in the last 14 days. If the answer is no, that child should just follow the protocol that we do for all children that are ill, send them home, call their parents, so on and so forth. If the child demonstrates those symptoms and has traveled to one of those places, we have a protocol. That child should just be given some space. We say isolate, but we don't want children to be treated any differently, but let's just kind of keep them in the health office for a little bit, call their parents, have them picked up as soon as possible. We recommend they get checked out by the doctor, and then to notify the school nurse, and the school nurse will follow up with that. All this information is intended to be confidential, so we respect that, and we will be communicating with the public health department if there are any cases.
And not just for at school, but for at home, what are some ways that staff and students can protect themselves? Should they be wearing masks, for example? I've heard that that's not a good idea.
So as of right now, the CDC does not recommend wearing masks, and so they're just saying to do your standard hygiene precautions, which, like Brisa said, hand washing with soap and water for at least 20 seconds. If soap and water isn't available, using hand sanitizer that has at least 60% alcohol base. Then also avoid touching your eyes, nose, or mouth, especially with unwashed hands. If you're going to cough or sneeze, then they say to cover your mouth and nose with a tissue. If you don't have a tissue, then to do it with your elbow. Chris? And so just the everyday precautions that we should be doing already.
And one of the questions that I heard from staff today were hand sanitizers and wipes and things that we said we were going to provide. What's the status of that?
Clorox wipes were sent to school sites today, And hand sanitizers are on order. We're working with our purchasing department, and those will be shipped out to the sites as soon as they arrive.
I do want to, so we did order Clorox wipes and hand sanitizers. I'm sure you've heard, like at Costco and other places, people are buying out inventory. So we want to caution people, like, use the Clorox wipes sparingly, use them on doorknobs and high profile things like light switches. We will absolutely order whatever we can and continue that coming. We're also working with maintenance and operations to get cleansers in spray bottles so that we can be disinfecting furniture in the evening. We're working with transportation also to be using that same disinfectant on the buses in the evenings. We've talked to nutrition. They're going to stop using open-air salad bars starting Monday and do more closed fruits and vegetables. These are all really just precautions. It's someone gave me the term an abundance of caution. We're just trying to keep germs low. Just keep your hands clean and away from your face, and we should be okay.
And don't forget to stay home if you're sick.
Yes.
Adults and children.
Adults
Yes,
and children.
students and staff.
Thank you.
Yes.
What about like traveling? You hear you shouldn't be traveling to certain countries, but for our schools that are going on field trips
Good question.
or Washington D.C. trips, is that something we should be looking at canceling at this point, or even the school closing, or what's the status of that?
That's a great question. So I don't know if you want to answer. Yeah.
So currently, right now, the CDC, the state, and the county doesn't have any restrictions as far as field trips or school activities. And so right now it's just business as usual. However, we are checking the updates on a regular basis, and of course we'll let staff know as things change. Currently, all the travel advisories are for outside of the United States.
And actually, thank you for bringing that up. We realized that with the information changing so quickly, hour by hour, day by day, we've actually been working with Howard. We're going to put something on the website that will be live that we can update anytime there's any changes. And we'll put there any announcements, any restrictions, any letters to parents, bulletins, FAQs. So you'll have a one-stop shop to get all of that updated information. Literally, it changes. So as of today, there's no warning or no advisory. If that changes, we'll post that. We'll be notifying staff.
Is there anything else that we haven't touched on that we should make sure that our staff hear?
Good question. It's important that that adults remain calm. There's a lot of information in the media. There's a lot of information. There's been sort of this escalated sense around the coronavirus, and children are starting to pick that up, and they're making up stories, or they're in the absence of information, they're starting to become anxious. So as adults, we wanted to assure everybody that everything is under control, and to really portray that to the children. We will let people know if there's something to be concerned about, but really to encourage kids, allow them to ask questions, and just remain level-headed about it. So.
Thank you very much. Another topic in the news that's more specific to Cajon Valley are employee raises. And we just finished bargaining season with all of our employee groups, and there have been some misleading stories in the news, some irresponsible journalism that has led to some questions about fairness, equity, and just what types of salary increases were provided to our employee groups. And no better than our Chief Business Officer, Scott, to help us communicate that.
Yes, all of our employee groups, including Cabinet, received a 3% ongoing salary increase this year and 1% off schedule. And for next year, since it was a 2-year deal, you all get 2% off on schedule money next year. So that is true across the board, no matter what employee group you represent, including Cabinet, we all got the same. There is some misunderstanding about certain members of Cabinet getting 15% raises, and why is that different than what our employee groups got? Like every employee group, we all have steps built into our salary schedules, and that's meant for longevity with the district. And so that's something that Cabinet moved up a step along with the increases, like many of our employees did at the same time. Just because Cabinet is focused and getting that out and being transparent, those salaries are actually presented with both those things combined into one. But all of our employees who are moving down the steps also got similar type increases above and beyond what the board gave out. And I just really want to say thank you to our board. They support all of our employee groups. for the hard work that's going on out there. And I think these increases for all of our employees is representative of what we're doing and the good things for our kids.
So thank you, Governing Board. And I also want to thank CSEA and CVEA for bringing these topics to our attention to say we need a little bit more information. Our employee groups have questions. And anytime there are topics that rise to a level of importance that you'd like communication, please let us know, and we will put together a communication like this so we can speak directly to you. Have a wonderful weekend, and thank you to our team here, and we'll see you Monday.